Dear students, welcome back. In the previous session, we have discussed about introduction regarding to posture. Now we are going to discuss about the kinetics and kinematics of posture. So in the previous session, we have seen some of the muscle strategies in response to perturbations or the examples of the active internal forces employed to counteract the external forces that affect the equilibrium and stability of the body in the erect standing posture. So again we will see the one of the example here. So to understand what are the external and internal forces here. So here a person is standing here on the base of the support and this platform is moving, so that means this becomes the external forces, and because of this movement some of the changes occurred in the posture of the body. Okay, and again the person is come back to his original position. Then what happens? For this external forces, the body show some reaction. Again the person has to come to its his own position. Then what he is doing, what happens inside here is the muscles, actually the muscles which are help in the movement of the body anteriorly, all those muscles are going to contract. That is here use of the ankle strategy. Okay, that is activation of the flexors and hip, trunk and possibly neck all combined to work, and they will again the person come back to its own original position. So here this is the external force, and for this reaction the body is undergoing some other reactions to come to his or her original position. So that becomes the internal forces which are employed to counteract the external forces which are affecting the equilibrium and the stability of the body in the erect stand posture. So here you have to get the clear idea of which is the external forces and which are the internal forces. Okay, so normally the external forces we are going to consider regarding in the posture. One is the inertia, gravity, and that is the gravitational forces. So and ground reaction forces. So what are the external forces we have to consider here in the kinetics and kinematics of posture? One is the inertia, and next one is the gravitational force. So this LOG, normally a person who is standing here, okay, for example this is the center of mass located here, okay, and this one becomes the center of mass, and this point is the center of gravity where the LOG falls here. So this, at this point the gravity is acting for that person, isn't it? So that means the gravity is an external force or internal force? Gravity is an external force. And so here the person is standing on the support, that means on the ground we can say. So person on the ground, a force is created. So what happened? A reaction force is coming against to this is the ground on person. So that means the person, the force which is acting against to the person who is standing on the ground, that is called as ground reaction forces. Okay, and if you see the inertia, normally inertia we can see in moving objects we can find. So inertia is the force which resists the motion is called inertia, isn't it? That is Newton's first law. So here that inertia also forms one of the external forces. But in the case of in the case of static posture, in the study of static posture, we are going to we are not considering the inertia here. Okay, and now if you see these are all the external forces. If you see the internal forces are produced by the muscle activity and passive tension in ligaments, tendons and joint capsules and other soft tissue structures. So these will cause the internal forces. So if a person want to be in an equilibrium, then all the forces, whatever the external forces and the internal forces which are produced on the body and by the body must be equal to zero, to keep the body in equilibrium. Okay, so the stability is maintained by keeping the body's COG, that is center of gravity, over the base of support and the head in a position that permits gauge to be appropriately oriented. Then only we can maintain the stability. So if any one of the body segment is not in this way, then equilibrium cannot be obtained. Okay, in the optimal erect standing posture, little or no acceleration of the body occurs except that the body undergoes a constant swaying motion called as postural sway or sway envelope. The extent of the sway envelope for a normal individual standing with about 4 inches feet apart, then the sway can be as large as 12 degrees in the sagittal plane. So this is the sagittal plane. So here we can see 12 degrees of swaying. We can see 12 degrees of swaying in 4 inches apart feet. Then we can find 12 degrees of swaying in the sagittal plane. Whereas in the frontal plane, if you see, this one is the frontal plane. This frontal plane sway we can see by 16 degrees. So in sagittal plane 12 degrees and 16 degrees postural sway can be seen. So usually the inertial forces, normally the inertial forces is the cause for the result of swaying of motion. And here we are not considering this small degree of this motions in this analysis of static posture. Okay, so these are all about the inertial and the gravitational forces. Okay, now the ground reaction force. Now the other external force is the ground reaction force. I have already explained here. So whenever the body contacts the ground pushes back on the body. So that force is known as the ground reaction force, that is called as GRF. Okay, and the vector representing it is known as ground reaction vector. So if you make an arrow over this line, you'll get the ground reaction vector. Okay, the GRF is a composite or resultant force that represents the magnitude and direction of loading applied to one or both feet. Okay, So the ground reaction force is typically having three components. Okay, it is having one vertical component, that is it is located on y-axis, and two horizontal components. One is at x-axis and another one is on the y-axis, z-axis, x and z-axis, and this one is vertical component is y-axis. So all these are perpendicular to each other. So normally this vertical axis is the y-axis. So one of the two horizontal forces is in the medial to lateral. So there is any movements in the medial to lateral, then we can consider the axis which is present along the x-axis. If there is a sway on anterior to posterior, then we are going to consider that axis as z-axis. Okay, so the composite or resultant ground reaction force is equal in magnitude but opposite in direction to the gravitational force in erect standing posture. Okay, and the ground reaction force vector indicates the magnitude as well as direction of the load applied to the foot. Okay, and another one, so as you all know that BOS is the base of support and COG is center of gravity, and here you can find another point of application of the ground reaction force vector at the body is called as center of pressure, that is COP, which is located in the foot. Center of pressure is located in the foot and in unilateral stance, which is located in foot in unilateral stance, and between the feet in bilateral stance, bilateral standing posture. So the center of pressure located in between the feet, whereas in unilateral stand it is located in the foot. Okay, if person were doing a handstand, for example, if person is standing with their hands, then COP is in between the hands. Okay, so the COP, like the COG, which is a theoretical point where the force is considered to act, although the body surface that is in contact with the ground may have forces acting over the large portion of the surface area. So the path of the COP is defined as the extent of the sway envelope can be determined by plotting the COP at regular intervals. Okay, when a person is standing on a force plate system. Okay, so here are some of the graphs. When a person who is standing on a plate system, so much of the research on postural control uses the pattern of displacement of the COP to evaluate the effects of the attentional demands as well as perturbations on a standing posture. Here if you see the first graph, so here this one is the path of center of pressure. This is the path of center of pressure in erect stance. A COP tracing plotted for a person standing on a force plate. The rectangle represents the outline of the force plate. This one, the rectangle represents the outline of the force plate. The tracing shows a normal rhythmic AP, antero-posterior sway envelope. So antero-posterior sway envelope you can see. So this one is seen during approximately 30 seconds of stance. Approximately 30 seconds of stance we can see a normal rhythmic AP sway envelope. So whereas in the plate B you can find the center of pressure showing relatively uncontrolled postural way. So there is no any rhythm here. So by by seeing this graph we can find this person has some coordination or postural imbalance by seeing this graph. Okay, so this is one of the things we can identify the center of pressure. Based upon center of pressure we can identify whether the person is having enough forces acting on the body or not. Okay, now here, so the ground reaction force and the LOG, that is line of gravity, have an coincident action lines in the static erect posture. So that means in static erect posture, the LOG and the ground reaction force, okay, LOG and the ground reaction force will fall in the same line in the static erect posture. Here we can see, so the location, this red line on this sagittal plane of the body, you can find the location of combined action line formed by the ground reaction force vector and the line of gravity in the optimal standing posture. Okay, so normally in an dynamic postures we can't find this two LOG as well as ground reaction force will not fall in the same manner. Okay, yes. So if both the forces or fall in a straight line, that means it is called as an ideal erect posture, and the body segments are aligned so that the torques and stresses on the body segments are minimized in this position, and standing can be maintained with a minimal amount of energy expenditure. Okay, the coincident action lines formed by the ground reaction force vector and the LOG serves as a reference for the analysis of the effects of the forces on the body segments. So if you know this optimal alignment of the posture, then we can analyze it with that of with the other different kinds of posture. Okay, so these are all about the kinetics of the posture. Now we will move on to the kinematics of the posture. So here the effect of external forces on the body segments during standing is determined by the location of LOG in relation to the axis of motion of the body segments. Okay, so when the LOG passes directly through a joint axis, therefore no external gravitational torque is created around the joint. Okay, however, if the LOG passes at a distance from the axis, for example, this one passes away from the some distance to this axis, then an external gravitational moment is created. So this moment will cause rotation of the superimposed body segments around the joint axis, unless it is opposed by a counterbalancing internal moment. So that means, because if this LOG falls somewhat away from this joint axis, then this one creates an external moment on this joint. So when it is going to create, if this force becomes greater than that of the muscular contraction, then it will create the gravitational moment here. Okay, otherwise it will not. That is the thing. So when there is an unbalanced force is created around the joint by this gravitational moment, by this gravitation, then it is called as an external gravitational moment. If it is counterbalanced by the internal moment, that is by the muscle contraction, then there is no movement taking place. Okay, that means both the forces become equal there. If it is not like that, then there is a movement around the hip joint will takes place. Okay, so now we will see some of the examples related to this one. Yes. So this one is the joint axis, that is at the ankle joint, and this one is the gravity line which is falling in front of the joint axis. So if it is falling on the joint axis, then there is no moment will takes place. Here what is happening? So here this axis, the gravity line falls in front of the joint axis here. Okay, so what is going to happen now we will see. Okay, so the magnitude of the gravitational moment of force increases, for example, as the distance between the LOG and the joint axis increases. So and the distance between the joint axis and the gravity line increases, then the magnitude of the gravitational moment force also going to increase. The direction of the external gravitational moment of force depends on the location of LOG. Depends upon the location of LOG in relation to a particular joint axis, whether this LOG is located on the anterior side or whether the gravity line is located on the posterior aspect. Okay, if the LOG is located anterior to the particular joint axis, then the gravitational moment will tend to cause anterior motion of the proximal segment. So here that is the thing happening. So the gravity line is falling in front of the joint axis, so which is causing the anterior motion of the proximal segment in the ankle joint, which is the proximal segment, tibia, so which is causing the direction of this one, so on the anterior aspect causing the dorsiflexion here. Okay, so whereas if the LOG falls on the posterior aspect, what happens? It causes backward movement of the proximal segment is going to takes place. Okay, so in a postural analysis viewed from the side, that is the sagittal view, external gravitational torques producing anterior and posterior motion, the proximal joint segment are either referred to as flexion or extension moments. Okay, so that is the thing is going to taking place here. So now we are going to see some of the examples here. So the anterior location of the LOG in relation to the ankle joint creates an external dorsiflexion moment, isn't it? So because the line is falling anterior, which is creating the proximal movement anteriorly. So the foot is fixed, but it is the movement, the proximal segment is moving on the distal segment. Then what is happening? So this motion is also called as dorsiflexion, isn't it? Yes. So now the another example we can see now. So there is another example to understand this thing here. If you see the gravity line which is falling on the anterior aspect of this knee joint, what is going to happen here? Okay, so if the LOG passes anterior to the axis of rotation of the knee joint, the external gravitational moment will tend to rotate the femur, that is the proximal segment, Okay, see the position, how the dotted lines is the movement. So what is happening? There is an anterior movement of the proximal segment, that is femur, in the anterior direction. So once the femur moves on the anterior direction, which is causing knee extension moment. So therefore the moment of force is called as extension moment. An internal flexion moment of equal magnitude will be necessary to balance the external extension moment. Okay, so these are all the movements, how, that is, these are the kinematics, how the movements around the joint axis is going to take place. It is mainly depends upon the LOG. If the LOG falls directly or through the joint axis, there is no movement. If the LOG falls in front of the joint axis, if you see in the sagittal plane, which causes anterior movement. If it is anterior movement to especially the proximal segment, so proximal segment will move. Okay, and if it falls on the posterior aspect, again the proximal segment will have the posterior moment. Okay, so in sagittal plane we can give those terms which are for as flexion and extension. Okay, so this is all about the kinetics and kinematics of the posture. Now in the next session we are going to discuss about optimal posture. Thank you.